The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
National Federation of Independent Business President Todd Stottlemyer, thanks for joining us today on health08.org.
Thanks for having me.
Tell us, what is the number one concern when it comes to health care for small businesses?
Well, the number one concern for small business has been the access to quality, affordable health care. And small businessmen and women across the country have told us this for the past 20 years, that they want access to quality, affordable health care. And fundamentally, it's around cost.
And you mentioned the time frame of 20 years. How has it changed in the last 20 years?
Well, a lot has changed in the last 20 years. Just in the last 8 years, the average small business is paying about 129% more for health insurance premiums. Healthcare costs continue to increase, and for the small business owner, the man or woman who has a small business, they pay about 20% more for the health care that they receive for themselves and their employees compared to a large business.
And why is that?
Well, they simply don't get the efficiencies of being in large risk pools, and that's very important to be able to spread risk and spread cost. And because these are smaller businesses, 5, 10, 15 employees, they cannot get into large risk pools. So they're paying a lot more for their insurance. The other reason is that small business is very split. About half of the small business community, they're in the small group insurance market. The other half is in the individual market. And that's just a very tough place to be today, both in the small group market where you can't get into big risk pools, and then the individual market where you're buying insurance as an individual.
The NFIB has come up with 10 principles for healthcare reform. They include universal, affordable, competitive, transparent, evidence-based, private, unbiased, portable, efficient, and realistic. How did you come up with this list?
Well, very importantly, we've listened to small businessmen and women from across the country for the last 20 years who said this is their number one issue, and we've gone out and really tried to understand their point of view, and that's a central part of who we are as an organization. We've also gone out, and over the past year, we've had some of the best and brightest people in healthcare from around the United States, center, left, right, academic think tank, and others, to come in and really work with us on these principles, to come up with a set of principles that we think will fundamentally make health insurance more available and affordable for small businessmen and women.
So how realistic is this list? How do you hope to get to accomplish all 10 of these principles?
Well, we think it's important to have a set of principles, and we think these principles should serve as the basis of any meaningful healthcare reform activity. I think one thing that's important for policymakers to know and understand, of the 47 million Americans who are uninsured today, 28 million of those are small businessmen and women who own businesses, their employees, and their dependents. So we think we really need to pay attention to small business. Our view is if you fix health care for small business, you're going to fix health care for America. So we're running a national campaign called Solutions Start Here. It's a multifaceted campaign to go out and listen to small businessmen and women across the country. We're doing significant research, and we're doing a significant grassroots effort to get small businessmen and women and their employees involved, and to let their policymakers know that you have to fix health care for small business.
You're hoping that people will start to listen to small business, and you're also reaching out to small businesses to find out what their problems are.
Well, we think they should listen to small business because we're the ones that create the jobs in America. We represent 50% of the gross domestic product, and today we create all the jobs on a net job basis, meaning that larger businesses, they create jobs, but they lose more jobs than they create. So we are the job engine of the American economy, and yet at the same time, we're the largest part of the working uninsured today in the American economy.
Do you think small businesses felt left out of the equation?
Well, I think they feel a little bit like the stepchild because, again, we create the jobs. We're the biggest piece of the American economy. We're the heart and soul of our communities, and yet the healthcare crisis is most acute for small businessmen and women and their employees. And so our job is to be their voice, and that's what we're trying to do, to be their voice. We want to be about solutions. I think in 1994, the last meaningful healthcare reform effort, it was probably enough to say no. Today, it's not enough to say no. We want to be part of a solution, and that's why we've put these 10 principles together, and that's why we're working so hard on behalf of small businessmen and women to let policymakers know that healthcare is the number one concern.
What are, to you, some of the biggest obstacles for reaching these 10 principles?
Well, I think we've had a lot of partisan gridlock, and I think getting people to understand that healthcare reform has to be bipartisan. that we have to do a lot more listening as opposed to talking at or to one another. And one of the reasons that we're participating in a coalition called Divided We Fail with some uncommon organizations that we don't have a lot in common with historically. That's NFIB, it's AARP, the Business Roundtable, and SEIU, the largest union in the country. There are a lot of things we don't agree on, but we do agree very much that health care needs to be on the agenda for the next President of the United States, as well as long-term financial security. And that's why we're part of this 4-member coalition called Divided We Fail. We need to break the partisan gridlock. We need to do something about health care because it's strangling our small business owners across the country, and certainly being the largest part of the working uninsured in America is not something that we want to continue in the future.
As you've been a part of Divided We Fail, do you feel like you've already seen some movement towards breaking that partisan gridlock?
Yeah, absolutely. I think we've been listening to one another, which I think is very important in trying to better understand where we're coming from, because we each represent constituencies that care very passionately about this country, that care very passionately about this country's future, and understand that the current health care crisis is not sustainable. I mean, we already spend 16% of our gross domestic product today on health care. And if we continue on the current path, it's going to be a lot higher. And more people are not going to have access to quality care and to health insurance. And we want that to end. And that's why we're spending a lot of time together. We're up on Capitol Hill meeting with policymakers together. We've launched this national campaign around Divided We Fail. And then NFIB has launched a Solutions Start Here national campaign as well. So we're not going to agree on everything. But I think very importantly, we're seeing some areas where we can agree, and there are some things we agree right off the bat. Information technology and putting more information technology into healthcare is something we think is very important, and all 4 groups feel very strongly about that. E-prescriptions and things like that. So there are areas where we do agree, and we're going to continue to work to see where we can find common ground and agreement.
So one area that it's possible that you all disagree on is the notion of mandates or the pay-or-play taxes. And this is something that's mentioned in your 10 principles that's really unacceptable for you. So would you characterize this as a non-negotiable moving forward, and how would that play out as you're talking with groups who likely would think that mandates would be a requirement for forward movement?
Well, 2 types of mandates. The first are treatment mandates, which get to what do we require insurers to cover. And what we've said is those treatment mandates should be evidence-based, that we really should rely on medical evidence to determine what types of mandates that we should have. And those mandates should be around areas that prevent premature death, around wellness and prevention. And we think, very frankly, it's more important for every woman in America to have access to a mammogram in a timely fashion and on a repeated basis than it is as it exists today in some states where insurers are required to cover hair transplantation and those types of things. Those are not mandates that are fundamentally around preventing premature death, where clearly a mammogram, a colonoscopy, a PSA test for prostate cancer, those are very important treatment mandates. So that's one part. The second part is how you pay for this. And again, the United States today, as a Western industrialized country, it's 16% of our gross domestic product. I mean, it's higher than any other country. So the dollars are there. It's how we spend the dollars in the system that we have. And that's why we've said very clearly that a pay-or-play mandate or a new payroll tax to pay for health care, we really don't understand what that has to do with fundamentally reforming the health care system, because the fundamental issue for our small businessmen and women across the country is affordability. And so if it's not affordable today, and then you're going to put a mandate on top of that to pay additional dollars, we're not sure how that addresses the fundamental issue today around access to quality health care, affordable health care.
So how does that play out with someone who believes that a mandate is necessary for moving forward? How would you work together with someone?
Well, I think we're going to disagree on that. I mean, I think that's something that we feel very strongly, that if you want to change the current path of health care in America, you have to look at the more endemic issues as to why health care costs are increasing so significantly, why only half of the small businesses in this country can afford to provide health insurance to their employees, and a mandate, a pay-or-play mandate, a mandate that we're going to increase a payroll tax. It doesn't get at the fundamental issues of health care today that we need to address in order to change the current path that we're on.